Hi guys, Dr. Lester here today, and today I want to talk to you a little bit about blood sugar and starvation. So this is specifically an important topic because fasting has been such a big deal, and I'm not saying that fasting is necessarily bad, but we will have a video specifically on fasting. So blood sugar and starvation is actually kind of what we see when we see some of the ketosis part of diabetes too, and fasting, like I said. So I want you to pay attention. I'll try and connect those dots. So when you're not taking in food because you're starving, because you're in the jungle by yourself and there's no way to get food, or maybe a desert's a better option, I don't know, whatever. Anyways, so you're starving and your body is not getting in food. So first thing it's going to use is whatever blood sugar is cycling around, it needs to try and use that. Any excess, it's going to try and use that. But it's important to maintain a certain level of blood sugar because all of your cells run off of blood sugar. So it's your liver's job to try and keep as much or the appropriate amount of blood sugar so it can keep your brain going, your heart going, all of those things at any given point. So when we see through starvation is what we see that the blood sugar stays relatively the same throughout the starvation process, no matter where you are. I mean, you're wasting away, but your blood sugar actually stays fairly level because that's the point. You need to keep the brain going, right? So you don't necessarily see spikes and valleys in this specific part. The first thing your body's going to go for is the glycogen. Glycogen is excess stores of quick sugar that it needs for when you're chasing a bear. Like if you haven't eaten in, a couple of hours and you need to chase a bear, then your body needs some major boosts of stores of energy. So it's going to go for this glycogen, which is just strands of little glucose that it's stored just as strands. So it's easily accessible. Your body goes for that, and once that's used up, which is pretty quick, it's within a couple of hours, then your body is going to start going for fat. Now, obviously, in a lot of weight loss things, we're definitely aiming at some of that, but you have to be really, really careful because aiming at this also has consequences. So fat are just long strands of glucose that were stored as glycogen, and then long strands, and then vacuum sealed in a bag to be stored as fat. So your body is going for this energy because it's long-term storage and we don't know when we're going to eat again, and it's been a minute. So we're opening the storage of energy, right? Which is good. And then after all the fat stores are used, it's going to start going for muscle, which is obviously a problem. So breaking down fats ends up having an acidic byproduct, and it creates ketones. So ketones are actually pretty acidic, and your body doesn't really like variation in acidity. It really, specifically your nerves. Your body really likes to maintain a certain level of pH, and that's really important for your body. And then once it breaks down this fat product, it has high levels of ketones, which are very acidic, and your body just wants to get rid of it. So it comes out in your urine. You do see this in diabetics, which, like as we talked about, it kind of becomes some overlap between that and with fasting as well. But you see ketones, and ketones can be very, very toxic. So it is important not to have this stuck in your system all of the time, and you want to get rid of this acidic product. So fat breakdown has this byproduct of a toxic, acidic ketone that we have to get rid of, and that is really important in starvation because it contributes to a lot of the nervous system dysfunction that we see, as well as some of the wasting process that happens with that. And lastly, when you have that kind of situation, then you're going to have, like as in dieting, right? You're going to have a rebound effect afterwards that's probably going to be worse because you had no food, then your body was like, oh my God, if there's any food that's coming in, we got to store that for as long as we can, make it work because we don't know when we're getting food again. So the minute you reintroduce food, then you're going to gain all of that weight back, if not more, because your body is in this freak out mode of we don't know when we're going to eat again. So this is kind of the problem with starvation in general. Obviously starvation's a problem, but I mean specifically like with weight loss dieting and whatnot, and even with inappropriate fasting, is that we see the body go into this fat storage mode where it's panicking about not being able to eat ever again. So it's going to take everything that it can. And then we're also seeing simultaneously this wasting byproduct that's toxic, that's going to acidify the whole system and cause neurological dysfunction and whatnot. So as a general rule, I want to just cover that as why yo-yo dieting is bad, why prolonged fasting can be a problem, and why you should do these things appropriately and with appropriate help. I hope that helps, guys. Thanks, guys.